own a botulinum toxin, or better known as Botox, Botox Cosmetic, or Botox Medical, like any drug approved by the FDA, has its ups and it has its downs. It is recommended that before one gets Botox, they find out more information about it because there are different types of Botox procedures, because one should get an idea of what to expect when getting a Botox procedure, and because it is important to know the risks of Botox before you get involved with it. After finding out the information needed or wanted, it is up to the person whether or not they still want Botox. It is recommended that before one gets Botox, they find out more information about it because there are different types of Botox procedures. The two types of Botox that are used for completely different reasons are Botox Cosmetic and Botox Medical. Botox Cosmetic is a common procedure that is used to improve the appearance of frown lines between the eyebrows and the looks of crow's feet. Botox Medical, according to Botox, is a type of medicine that is used to treat patients with certain neuromuscular conditions. Some of the conditions that Botox has helped treat are cervical dystonia, lazy eye, muscle contractions, hyperhidrosis, chronic nightmare, and bladder dysfunction. Both of these procedures can be done through the same company, but are used for two completely different reasons. It is recommended that before one gets Botox, they find out more information about it because one should get an idea of what to expect when getting a Botox procedure. Botox procedures may be quick, but if one was to arrive at the doctor's office without knowing what happens during the procedure, it could be slightly intimidating. According to the Mayo Clinic, it is best to choose to have the skin numb beforehand, even if the person getting the treatment has handled injection discomfort well. Different ways to get the skin numbed are injections, creamed, and cold sprays. Also, according to the Mayo Clinic, during the procedure, your doctor uses a thin needle to inject tiny amounts of botulinum toxins into your skin or muscles. After the procedure, it is okay to resume with your everyday life, but the patient should refrain from touching the injection site and lying down for a couple of hours. It is recommended that before one gets Botox, they find out more information about it because it is important to know the risks of Botox before you get involved with it. Like most drugs, Botox has been approved by the FDA and tested extensively, but that doesn't mean that there aren't risks that go along with the procedure. If the patient wants the procedure to go well and have minimal risk of anything going wrong, they should make sure to do research on which doctors would be best for the job. If one does not find out more information on what doctor to use, something could go wrong. For example, if an injection is placed improperly, it could lead to eyelid drop, cockeyed eyebrows, crooked smile, and dry eye or excessive tearing. Even more dangerous, according to the Mayo Clinic, if the Botox spreads to other parts of the body, it could lead to muscle weakness all over the body, vision problems, trouble speaking or swallowing, trouble breathing, or loss of bladder control. It is best to make sure the patient does enough research on the risks beforehand because although both the cosmetic and medical procedures are generally safe, both could cause serious side effects that could potentially be life-threatening. It is recommended that before one gets Botox, they find out more information about it because there are different types of Botox procedures, because one should get an idea of what to expect when getting a Botox procedure, and because it is important to know the risks of Botox before you get involved with it. Getting Botox can be a big deal for anyone. It is best to make sure that the patient goes into the doctor's office with as much knowledge about the product as possible. If the patient is calm and knows what to expect, the Botox procedure will be easier on everyone.